Unmasking the Trio: Trachea, Bronchus, and Lung Cancers, a comprehensive overview. Trachea, bronchus, and lung cancers collectively constitute a formidable group of malignancies that pose significant challenges to global public health. These cancers, primarily associated with tobacco use and exposure to environmental pollutants, represent a complex spectrum of diseases with diverse origins, manifestations, and treatment modalities. As we delve into the intricacies of trachea, bronchus, and lung cancers, it becomes evident that a comprehensive understanding is crucial for effective prevention, early detection, and management. The trachea, bronchi, and lungs form an integral part of the respiratory system, working in unison to facilitate the exchange of oxygen and carbon dioxide. The trachea, commonly known as the windpipe, is a tubular structure that connects the larynx to the bronchi. It branches into the left and right bronchi, which further divide into smaller airways known as bronchioles. The bronchioles lead to the alveoli, tiny air sacs where the exchange of gases occurs, enabling the oxygenation of blood. Tracheal cancer. Tracheal cancer is a rare malignancy that originates in the cells lining the trachea. The majority of tracheal cancers are squamous cell carcinomas, but adenoid cystic carcinomas and mucoepidermoid carcinomas can also occur. Symptoms may include persistent cough, wheezing, difficulty breathing, and hemoptysis, coughing up blood. Due to its rarity, tracheal cancer poses diagnostic challenges and often requires a multidisciplinary approach to treatment. Bronchial cancer. Bronchial cancers primarily arise in the bronchi, the larger airways branching from the trachea. Non-small cell lung cancer, NSCLC, and small cell lung cancer, SCLC, are the two main types of bronchial cancers. NSCLC, which includes adenocarcinoma, squamous cell carcinoma, and large cell carcinoma, constitutes the majority of cases. SCLC tends to grow and spread more aggressively. The risk factors for bronchial cancer are largely attributed to smoking, although non-smokers can also develop the disease due to genetic predispositions or exposure to environmental carcinogens. Lung cancer. Lung cancer is a broad term encompassing cancers that originate in the lungs, including those affecting the bronchi and bronchioles. It is the leading cause of cancer-related deaths globally. Lung cancer is divided into two main types: non-small cell lung cancer, NSCLC, and small cell lung cancer, SCLC. NSCLC accounts for approximately 85% of all lung cancers, while SCLC is notorious for its aggressive nature. Risk factors for lung cancer include smoking, exposure to secondhand smoke, environmental pollutants, and a family history of lung cancer. Risk factors. Tobacco use. Smoking, both active and passive, stands out as the leading cause of trachea, bronchus, and lung cancers. The carcinogenic components of tobacco smoke inflict cumulative damage to the respiratory system, increasing the risk of malignant transformations in the cells lining the trachea, bronchi, and lungs. Environmental exposures. Prolonged exposure to environmental pollutants such as asbestos, radon, and certain industrial chemicals elevates the risk of developing lung cancers. Asbestos exposure, prevalent in certain occupational settings, is associated with an increased risk of mesothelioma, a cancer affecting the lining of the lungs. Genetic factors. Genetic predispositions play a role in some cases of lung cancer, particularly in non-smokers. Individuals with a family history of lung cancer may have an elevated risk, emphasizing the importance of understanding one's genetic background in assessing susceptibility. Chronic respiratory conditions. Pre-existing chronic respiratory conditions like chronic obstructive pulmonary disease, COPD, and pulmonary fibrosis can contribute to the development of trachea, bronchus, and lung cancers. Inflammation and tissue damage associated with these conditions create an environment conducive to cancer growth. Symptoms. The symptoms of trachea, bronchus, and lung cancers often overlap, making early detection challenging. Common symptoms include persistent cough, wheezing, shortness of breath, chest pain, recurrent respiratory infections, and coughing up blood. As these symptoms can be indicative of various respiratory ailments, a thorough clinical evaluation and diagnostic tests are essential to pinpoint the underlying cause. Diagnosis. Imaging studies, chest X-rays, CT scans, and PET scans are commonly employed to visualize the lungs and detect abnormalities, such as tumors or nodules. These imaging studies play a crucial role in assessing the extent and staging of the cancer. Biopsy. Biopsy, where a small tissue sample is taken for laboratory analysis, is the definitive method to diagnose trachea, bronchus, and lung cancers. This can be achieved through procedures like bronchoscopy, needle biopsy, or surgical biopsy, depending on the location and accessibility of the suspected cancerous tissue. Sputum cytology, examination of sputum under a microscope, can reveal the presence of cancer cells. While this method may not provide a definitive diagnosis, it can be a valuable tool in identifying abnormal cells, prompting further diagnostic investigations. Bronchoscopy. This procedure involves the insertion of a thin, flexible tube, bronchoscope, through the nose or mouth to visualize the airways. It allows for direct examination of the trachea and bronchi and facilitates biopsy or sample collection for analysis. Treatment. The treatment of trachea, bronchus, and lung cancers depends on various factors, including the type and stage of cancer, the patient's overall health, and the presence of specific genetic mutations. Treatment modalities may include surgery. Surgical interventions such as lobectomy or pneumonectomy involve the removal of a portion or the entire affected lung. Surgical options depend on the extent and location of the cancer. Radiation therapy. High-dose radiation is used to target and destroy cancer cells. It may be employed as the primary treatment or in conjunction with surgery and chemotherapy. Chemotherapy. Systemic chemotherapy involves the administration of drugs to destroy cancer cells throughout the body. It is often used in cases where the cancer has spread beyond the lungs or when surgery is not a viable option. Targeted therapy. Targeted therapies are medications that specifically target cancer cells based on their unique characteristics. These therapies are often used in cases with specific genetic mutations, such as epidermal growth factor receptor, EGFR mutations. Immunotherapy. Immunotherapy harnesses the body's immune system to target and eliminate cancer cells. It has shown promise in treating certain types of lung cancers, particularly those expressing programmed death ligand 1, PDL1, and challenges in the management of trachea, bronchus, and lung cancers include the often advanced stage at which they are diagnosed, limited treatment options for certain subtypes, and the high rate of recurrence. Additionally, the association with tobacco use underscores the need for comprehensive tobacco control measures to reduce the incidence of these cancers. Prevention and public health initiatives. Tobacco control. Efforts to curb tobacco use, including smoking cessation programs, public awareness campaigns, and strict tobacco regulation policies, are pivotal in preventing trachea, bronchus, and lung cancers. Public health initiatives should target both active and passive smoking to reduce overall tobacco-related morbidity and mortality. Environmental awareness. Increasing awareness about the risks associated with environmental pollutants, occupational exposures, and radon is essential. Implementing measures to reduce exposure to these carcinogens, especially in high-risk occupational settings, can contribute to cancer prevention. Early detection programs. Establishing and promoting early detection programs, including regular screening for high-risk individuals, can significantly improve outcomes. Low-dose CT scans have shown effectiveness in detecting lung cancers at an early, more treatable stage. Genetic screening. Genetic screening for individuals with a family history of lung cancer or those with known genetic predispositions can aid in identifying individuals at higher risk. This information can guide personalized prevention and surveillance strategies. Conclusion. Trachea, bronchus, and lung cancers collectively represent a major global health challenge, necessitating a multifaceted approach encompassing prevention, early detection, and innovative treatment modalities. While advancements in research and treatment have improved outcomes for some patients, the high mortality rates underscore the need for continued efforts in understanding the complexities of these malignancies. Public health initiatives, comprehensive tobacco control measures, and advancements in personalized medicine hold promise in reshaping the landscape of trachea, bronchus, and lung cancer management. Through collaborative efforts involving healthcare professionals, researchers, policymakers, and the community, we can strive to mitigate the impact of these cancers, ultimately improving the prospects and quality of life for individuals affected by trachea, bronchus, and lung cancer.